I'm presenting 57-year-old female African-American descent with a past history of reproductive cancer of the placenta with a molar pregnancy derived from disordered lipid metabolism and systemic inflammation. She juiced daily fruits and vegetables with an added nutriment supplement, and she was on chemotherapy for 6 months, and now she's been cancer-free for 22 years. Currently, she's menopausal with hot flashes, not feeling well, slight depression, adult acne, and itching face. She does not feel like herself since menopause. That's her current concern. She wants to know how to take care of herself properly, how to cleanse her insides properly, and how to detox and balance her hormones. Her medical diagnosis currently is high blood pressure and high cholesterol. Her bowel movements are 1 every other day, lumps, very dark, sticky, incomplete evacuation. Her family histories, her parents, her mother has hypothyroid and high blood pressure, and her father has high blood pressure and high cholesterol. She's 65 inches at 206 pounds, and her BMI is 34.27 in class 1 obesity, and she has a waistline of 43 inches. Her current dietary assessment is that she is a critically deficient in micronutrients due to poor quality food choices and insufficient quantity of food at each meal. For breakfast, she consumes egg and cheese or egg and turkey croissant. Lunch, she is store-bought orange or cranberry juice, about 12 ounces. Dinner consists of prepackaged meal, chicken Alfredo or spaghetti or baked potato. And she consumes a bag of potato chips 2 to 4 times per day. She drinks alcohol, has a high red meat consumption, and she consumes about 1 glass of water a day. So she is very inadequate in antioxidants and phytonutrients, creating deficiencies. And she has a mild activity level. She walks for an hour every day, and she's active with her friends and family. And she rates her stress levels at a 3, and her work stress at an 8. She's bored with life, and she's ready to move on and find something new to do, especially with food. She's bored around food since she's an empty nester. Her NFPE, she may have circulatory and vascular weakness and faulty digestion due to the hair thinning at the crown, possible zinc, protein, and iron deficiencies. Her face itches daily for no reason. She has possible inflammation and possible allergies due to dark pigmentation around the eyes. And a current dark line down the middle of her finger suggests by WebMD that she may have signs of melanoma. And she's on Simvastatin, which is a statin drug, so there's possible CoQ10 depletion. And she's on Trimesterine. There's possible sodium and calcium and water depletion and excess potassium. Her symptom burden is her symptoms, her biological systems that are burgeoning is endocrinology, cardiology, and hepatology systems. Her mediators are inflammatory cytokines, chronic stress, and so forth. And her assessment of her nutritional status, she is currently approaching subclinical deficiency due to possible melanoma, noted by a dark line on her middle right finger, history of reproductive cancer, current poor dietary intake and choices, and possible micronutrient deficiencies, and her current medication use, and possible endocrine imbalances, systemic inflammation, metabolic syndrome, and chronic stress. Her main nutritional diagnosis is undesirable food choices related to food-related knowledge deficit concerning food and supplement sources of minerals and vitamins, as evidenced by hair loss, nail fragility, constipation, fatigue, dermatitis, less than optimal food intake, high trans fat, and low omega-3 consumption. Okay, my overall goals for her case is to lower the animal fat intake, to increase the cancer protective foods, to reduce exposure to environmental toxins, to improve her hydration and replete her vitamin or mineral status, to boost energy and balance her hormones, and to detoxify the body of toxins. And some of the long-term interventions I will recommend would be to increase bowel functioning by taking fiber, quercetin supplement to abate inflammation, to support a microbiome with yogurt and fermented food and drinks, to take CoQ10 to deplete her stores, to read product labels, to avoid GMO and MSG foods, to incorporate green powder drinks and smoothies with blackstrap molasses,